I would like to talk today about hair restoration surgery, also known as hair transplant surgery. Hair loss is very common. It is estimated that by the time people get to 30 years of age, 30% have already experienced some form of hair loss. And by the time they get to 40% have already experienced some form of hair loss. Now, why is hair loss so common? The causes of hair loss are stress, poor diet or poor nutrition, infections of the scalp, dermatological conditions known as alopecia areata, hormonal imbalances, particularly seen in women approaching the menopause, conditions such as hypothyroidism, and male and female pattern baldness. Hair loss can be treated using a variety of modalities. It can be treated using a medical approach, which following a clinical examination, patients are put on medications such as minoxidil or finasteride. There is also the surgical approach, which is essentially hair transplant surgery. Now, when it comes to hair transplant surgery, there are essentially two approaches, either the follicular unit transplantation, where a strip of scalp is taken from the sides and the back, and then the individual terminal follicles separated under a microscope and then transplanted onto the affected areas. The other technique, which is now gaining common ground, is known as the follicular unit excision, which is the FUE technique. Now, we have recently in the practice invested in an innovative FUE device known as the Devroye Waw Duo system, which comes with a computer system, a little computer, which allows you to monitor or adjust the oscillation or the rotation of the devices that are used for harvesting the hair grafts. The computer also allows you to monitor the length of the surgery as well as to count the number of grafts harvested. When it comes to the device, we got two devices. The wired device, which is connected to a pedal, and we have a tip which is put on the tip, and that allows you to harvest individual hair follicles. We've also got the wireless device, which is connected to the pedal using a Bluetooth connection, which also allows you to harvest individual hair follicles. Once the follicles are harvested, we then examine them under the microscope to make sure that the follicles are not transected, and to ensure that the terminal follicles are intact. Now, it is a great system, and we're very proud to have it in our practice, and we're now getting some really good results. If you're suffering from hair loss and you wish to discuss this further, please do not hesitate to reach out to us. We'll carry out a face-to-face consultation, and then we'll give you the appropriate treatment. Thank you.